name's Tracy. I'm going to be your nurse today. I'm just going to do a head to toe assessment on you. Can you tell me your name?
Adam.
And what year is it?
2016.
Okay, and who's the president?
Barack Obama.
Okay. Patient is alert and oriented ×4. He appears well dressed, clean shaven, and is alert, which is all normal. So first we're going to start with your head. I'm just going to palpate. I don't feel any lumps, no lesions, no tenderness. Do you have any pain when I'm touching you?
No.
No. Okay. The hair is thick and evenly distributed. The skin is warm and dry. Okay. And now I'm going to have you smile, frown, stick your tongue out. Okay, good. Those are all symmetric. There's no drooping on either side of the face. Now I'm just going to palpate. I'm going to take these off. And I'm going to palpate your temporal artery. Okay, it is even on both sides. Okay, now I'm going to have you open your mouth and close, and open again, and close. Okay, so the temporomandibular joint is intact bilaterally. And now I'm just going to press on your sinuses, and you let me know if you have any tenderness. Any tenderness when I push?
No.
No? Okay. Non-tender sinuses. Now we're going to test your eyes. So first, I'm going to have you cover up one of your eyes. Okay, very good. And I want you to let me know when you see the light.
No.
Okay, good. And on the other side?
No.
Okay, good. Confrontation is equal bilaterally. And now I'm going to have you look at my eye chart here, and I want you to read the furthest line that you can.
FEBOCR.
Okay, good. And now cover up your other eye.
FEBOCR.
Okay, very good. Vision is 20/20 in both eyes. Okay, and then I'm going to take a look at your pupils now. So I'm just going to have you look straight at my nose. Okay, pupils are equal and reactive to light and accommodation. Now I'm going to have you follow my finger with just your eyes. Okay, very good. And I'm just going to take a look at your eyes now. Okay, the conjunctiva are pink, the sclera is white, the irids are round. There are no lesions anywhere on the eyes. Okay, now we're going to move on to your ear. So next, I'm just going to take a look at both of your ears here. They are both pink and warm, even pigmentation. It matches the rest of his skin. No lesions or lumps anywhere. Do you have any tenderness when I'm pressing or anything?
Nope.
Okay, non-tender. Now I'm going to take a look at in each of your ears. I would use an otoscope to do this. So I'd look in your ear. Okay. And let's look in the other one. Okay, there's no redness or swelling or discharge coming from either of the ears. And now we're going to do the whispered voice test. Is that still recording? So Now we're going to do the whispered voice test. So I'm going to have you plug one of your, there you go. And I'm just going to whisper a set of letters and you just repeat them.
FDC.
Okay, very good. And now the other side.
SBL.
Okay, very good. All right. Now we're going to take a look at your nose. It is midline. It's appropriate and proportional to his other facial features. There's no lesions or lumps. It's non-tender. And I would look, I'm going to have you tilt your head back, and I'm just going to look up your nose. Both sides. I don't see a deviated septum on either side. The nasal mucosa is pink and moist. There are no lesions or lumps. Okay, and now I'm going to have you plug one side of your nose and smell, sniff. Okay, now the other. Okay, bilateral nostrils are patent. There is no blockage. Now we're going to take a look at your mouth. So I'm just going to have you, your lips are pink and dry. There's no cracking, no lesions seen. I'm going to have you open your mouth. And we're just going to take a look in here. The teeth are straight and white, proportional to his mouth. The gums are pink and moist. There's no bleeding, no lesions. The palate is pink. And the hard palate is pink also. No lesions. Now we're going to look at your tongue. Can you stick out your tongue and say ah? Okay, the tonsils are present. They are pink. You can stop. They're pink. I would rate them a grade 1. Your uvula is midline. It rises in the middle when you say ah, and your tongue is pink and moist. There are no lesions. I'm going to have you stick out your tongue now and move it side to side. Okay, good. Cranial nerve 12 is intact. And now we're going to take a look at your neck. So the skin on the neck is warm and dry. There are no lesions, no tenderness when I'm pressing anywhere. The head is erect on the body in the midline. And now we're going to palpate your cervical nodes. You let me know if any of this is tender. We've got preauricular, posterior auricular, occipital, submental, submandibular, jugular-digastric, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Okay, I didn't feel any lymph nodes. They were non-tender, freely movable. And now we're going to check your carotid pulse. So first I'm just going to palpate on both sides. I would rate it a 2+ bilaterally. Okay, and now I'm just going to listen with the bell of my stethoscope, and I'm going to listen for a bruit. Okay, the other side. Okay, no bruit was heard. Pulses are equal bilaterally. And your trachea is midline. I don't feel any nodules. It's non-tender. And now I'm just going to have you turn your head to the right and to the left. Look up and look down. Okay, and shrug your shoulders. Okay, and now you're going to do that with resistance, so turn your head to the left. Okay, and the right. Good, now shrug your shoulders. Good. Full range of motion, patient is, muscles are all strong and normal. Now we're going to move to the back and do your thyroid. Make sure this is still. Okay. So we go to the back for the thyroid because it's easier to feel from the back. It relaxes the neck muscles. So now I'm just going to have you tilt your head forward a little into the right. There you go. Just going to feel for your trachea. Okay. All right, and now I just want you to take a sip of water and swallow. Okay, very good. I did not feel any nodules. The thyroid was not enlarged, non-tender. And now we're going to take a look at your chest. The skin appears warm and dry. There are no lesions or lumps. The shoulders are both symmetric on the body. It's non-tender throughout. Okay, so now I'm gonna have you take a deep breath in and out. Very good. My hands move apart symmetrically, which means there's symmetric expansion of the lungs. And now we're gonna do tactile fremitus. So I'm gonna have you say 99 each time I put my hands on your body.
99, 99, 99, 99.
Okay, good. Vibrations were symmetric on both sides. And now we're going to palpate your spinal processes. Do you have any tenderness anywhere impressing?
Nope.
Good. Okay, and now I'm going to take a listen to your lungs. Normally I would listen to a full inspiration and expiration in each spot. Okay, and just take a deep breath. Okay, lung sounds are clear bilaterally. I did not hear any adventitious sounds such as wheezes or crackles. Okay, so now we're going to move back to the front of you and we're going to look at your chest on the front. And I'm going to count your respiratory rate. I would count how many respirations you have for 30 seconds and multiply it by 2. We'll say it is 16, which is normal. They're unlabored, non-labored, breathing evenly. The skin is warm and dry. There are no lesions or lumps anywhere, non-tender, even pigmentation throughout. And now I'm going to have you say 99.
99, 99, 99, 99.
Okay, the vibrations were symmetric bilaterally. And now I'm going to take a listen to you. Okay, deep breath. Okay. Lung sounds are clear bilaterally. I did not hear any wheezes or crackles. Now we're going to take a look at your upper arms here. See, your nails are smooth, rounded. There are no lesions, lumps, no bleeding. The skin is warm and dry on the hands, intact. We're going to palpate your epitrochlear lymph nodes. And on the other side. I do not feel any. They are non-tender, freely movable. And now we're going to palpate your axillary lymph nodes. Non-tender, freely movable, no swelling. or lesions present. And I'm going to check your pulses here. Okay, I would give the pulses all 2+, radial, ulnar, brachial. Now we would do the modified Allen's test, where I would occlude both the radial and ulnar arteries and see if the patient's hand blanches, which it does. Then when I release, the color returns, which is all normal. Okay, so now we're going to listen to your heart. I am going to have you go ahead and lay down. Okay. So first, I'm just going to take a look at your chest. I don't see any pulsations. There's no heaving going on. And now I'm going to check your apical impulse, which is the 5th left intercostal space in the midclavicular line. I'm going to palpate it first. I don't feel a thrill. It is regular and even. And now I'm going to listen. I would listen to the apical rate for a full minute. The rate is regular, and the rhythm is regular as well. And now starting at the apex of the heart, I'm going to listen to the different areas. So first, we're starting at the mitral, which is the 5th left intercostal space. Then I move to tricuspid, 5th left intercostal space near the sternal border. And then Erb's point, which is the 3rd left intercostal space near the sternal border. Then the pulmonic, which is 2nd left intercostal space. And aortic, which is the 2nd right intercostal space. Okay, now I'm going to listen with the bell of my stethoscope. I'm listening for any murmurs. So again, we're going to start at the apex of the mitral, tricuspid, Erb's point, pulmonic, and aortic. Okay, the heart rate is regular. I didn't feel or hear any bruits or murmurs were present. Now I'm going to have you roll over onto your left side and I'm going to listen again. And I'm listening at the apex of the heart again at the 5th left intercostal space. I'm listening to the diastole or the filling of the heart and listening for any murmurs. We'll listen for a full minute again, and I do not hear any murmurs. Okay. I'm going to have you lay back just one more time. Thank you. And I'm just taking a look at your jugular venous pulse. I do not see any pulsations in either side of the neck, which is normal. Okay. And now we're going to move to the abdomen. So, your abdomen is flat in contour. I do not see any lesions. The skin is warm and dry. I don't see any pulsations anywhere. The umbilicus is midline and inverted. And now we're just going to take a listen. I would start in the right lower quadrant because vowel sounds are normally present here. And if I did not hear any vowel sounds, I would listen to a full 5 minutes in each quadrant. Patient has vowel sounds present throughout. Okay, now I'm just going to percuss now. Okay, tympani was heard throughout except over the liver and the spleen. It was dull, which is all normal. And now we're going to do light and deep palpation. You let me know if you have any pain when I'm doing this. Any pain with that?
No.
No? Now we're going to move to deep palpation. There's no rebound tenderness. Nothing feels enlarged. The patient is non-tender throughout. And now we're going to check your groin for femoral pulse on each side. The pulse is 2+, bilaterally, even and regular. And now we're going to feel for the inguinal nodes, which I do not feel. They're non-tender, freely movable. Okay, very good. And now we're going to move to your lower extremity, so you can sit up again. Just going to take a look at your legs. The skin is warm and dry. There are no lesions. And I'm going to palpate your pulses. The popliteal on both sides is even and regular. And now we move to your pretibial. That's +2 as well. And your pedal. All pulses are +2 and even and regular. And do you have any calf tenderness?
Nope.
No calf tenderness. Perfect. Now I'm going to have you lay back one more time. And we're going to check the range of motion of your hips. I would do both sides, but for the video, I'm just going to do one side. So I'm going to have you raise your leg up. Okay, and down. Good. No crepitation was felt. And go out and in. Good. Now bend your knee up and push your, there you go, in and out. Good. No crepitation, full range of motion of the hips. And now we move to your knees. I'm just going to have you straighten out your knee. Good. No crepitation was felt. And now your ankles and your feet. I'm going to have you point your toes up. And point them out now. Good. Point both your toes inward. Yep, and out. Very good. Full range of motion of the ankles and the feet. And now we're going to do light touch to your face and the rest of your body. So I want you to close your eyes and you let me know when you feel something.
No. 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 No.
Okay? And now we're going to do it with firm touch. And again, you let me know when you feel it, okay?
No. 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 No.
Okay, very good. Sensation is equal bilaterally. I'm going to have you touch my finger and then touch your nose. Okay, very good. And now we're going to have you lay back. And I'm going to have you scoot back more. There you go. I'm going to have you take your shin, your heel of your one foot, and rub it up and down against your shin of your other. Very good. And now the other side. Okay, very good. Equal on both sides. Now we're going to check some reflexes. So you can sit back up. I'm going to do the bicep first. Okay. All right, the tricep was they're all equal. The brachioradialis, equal bilaterally. And now we're going to do your patellar. So ideally, your leg would be off. There you go. Ready? Okay, and the other side. Okay, very good. Equal bilaterally for the patellar. And now your Achilles. I'm gonna take one of your feet. Okay. All right, equal bilaterally for the Achilles. And we're gonna check the Babinski, which should be negative. Okay, it was negative on the right and negative on the left. Beautiful. And now I'm going to have you go ahead and walk across the room. Okay, now walk back on your heels. And walk back the other way on your tiptoes. Okay, and then come back. And I'll have you stop right there. I'm going to have you close your eyes and just rest down, feet together. Yep. Okay, and now close your eyes, and I'm just going to watch. Make sure your perception is intact, which it appears to be. Some minor swaying would be completely normal and expected. Okay, and that's it. Thank you very much for your time.